The St. Louis Metropolitan Task Force reported a slight increase in COVID-19 cases heading into winter.
But local health leaders say it's nothing to worry much about. 5 on your side's Pepper Baker joins us live to explain the next phase of the pandemic as we head into the holiday season. Pepper.
Yes, the head of the St. Louis Metro Task Force, Dr. Dunagan, says they've seen an almost 6% increase of new cases in our region over the last 2 weeks. Now, I got a second medical opinion to explain what the next phase of the pandemic is and whether this is a virus we're going to have to learn to live with.
We're looking at a period that's likely to be stable to slightly increasing rates in the coming weeks.
As the holiday season approaches, head of the St. Louis Metro Task Force, Dr. Dunagan, explains the region's COVID-19 trends during their most recent briefing.
This is the 14-day rolling average, looking at it week over week. And unfortunately, we are in positive territory for the first time in a while, up almost 6%.
Dunagan expects to see the data go through ebbs and flows in the coming months as we enter this new endemic phase of the disease, comparable to the flu.
There's been a lot of discussion about, as with other respiratory conditions, if we're going to see a seasonal kind of component to COVID. Certainly, we did see our largest surge last winter time.
Dr. Rachel Charney, medical director for emergency preparedness at SSM Health Cardinal Glennon, believes we're still a few years away from COVID reaching a steady state.
You know, this is a little different from other colds and flus that most people are exposed to at some point throughout their childhood, and it's kind of spread out, versus we still have a large part of our population that's still susceptible.
Dunagan and Charney say vaccinations are the best way to mitigate the virus.
That would be probably a best case, that it just becomes one of those that is here for a few months in the winter and then goes away for the rest of the year.
I suspect this is something that's going to remain at some level within our population for the long term.
Now, as many of us plan to spend the holidays with our families, Dr. Charney says it's always a good idea to keep those healthy habits going, like hand washing, social distancing, and masking. In St. Louis, Pepper Baker, 5 on your side.